Welcome to the Dr. Berkson's Best Health Radio Show. You know, some people say, no pain, no gain. But is that really true for physical pain? Have you ever really had a severe pain in your back? Some people call it my back slipped, my back went out, but it's really disc disease. And what we're going to be talking about today are brand new therapies for how to treat a herniated disc. Disc is a cushion between your vertebra, and when it can push out, it can create pressure on your nerve root. And there is nothing in this world like nerve root pain. Oh my God. It's a pain that you feel that you can't live with. That's nerve root pain. It's very different than other pains. So there's only 2 medical surgeons in the United States that do this brand new treatment for discs. And we have one of these surgeons on this show today. So we are really lucky. Who we have, and I hope I'm pronouncing his name right, is Dr. Warren Bleiweiss. Thank you. Dr. Warren J. Bleiweiss. And he has quite a vitae. A vitae, of course, is all of the things that have made him who he is today. He's a diplomate of the American Board of Anesthesiology. He's a diplomate of the American Board of Pain Medicine. And that's what we're talking about, is a brand new intervention for pain, especially back pain. A diplomate of the National Board of Medical Examiners. He's got a license to practice medicine in New York. He's got a license to practice medicine in New Jersey. He went to the New York University School of Medicine, and also he graduated cum laude. I did too, from the University of Michigan, and it's really hard work to get to do that. Well, Dr. Bleiweiss is a leader in the United States in the emerging medical field of oxygen ozone disc injection. And we are going to be talking and asking him questions about what is oxygen ozone disc injection therapy? Why should we even consider it? Why did he get into this? So welcome to the show, Dr. Bleiweiss.
Oh, thank you.
So this is really unusual. And you reached out to me to get on the show because a lot of people out there don't know about this. There's only 2 surgeons doing this. So what exactly is oxygen ozone disc injection therapy? And that is a mouthful.
Well, oxygen ozone disc injection therapy is carefully injecting a very specific concentration of ozone in a pure oxygen environment into the disc, into a very specific portion of the disc. And it has great properties to reduce the pain of disc herniations and degenerative disc disease, and it's also very healthy for the disc. I want to just step back for a moment and stress the fact that it's a specific amount of ozone in a pure oxygen environment, because a lot of us have heard about the ozone in the atmosphere. When it's very high, we're told to stay, if you have asthma, stay in the house, or lung disease, stay in the house. That's because that ozone is combining with the other elements in the atmosphere. For example, there's 81% nitrogen in the atmosphere. There's smog in the atmosphere. There are other things in the atmosphere that the ozone will combine with, and it's not healthy for us to breathe in those compounds. Medical oxygen ozone is created by a very specific generator in a very specific concentration. That's important. And it's in a pure oxygen environment.
What does that mean, a pure oxygen environment?
So when we generate the ozone for medical purposes, it's in a closed system, and oxygen goes in a particular amount of energy that the physician or the practitioner chooses beforehand to create a concentration of ozone that's very specific, will be applied to the oxygen, and that will split off some additional molecules of oxygen. So as you know, oxygen in the atmosphere is O2, so it's 2 molecules. Ozone is O3. So by splitting off an oxygen molecule, ozone will exist, and ozone usually exists in a ring form.
Now, what do you mean splitting off? Because at first there's O2 and you say splitting off, but then you say O3. So can you explain what that means to our listening audience?
Yes,
They might be saying, what is that math out there? Okay.
Right. So think of two oxygen molecules together, and there's a bond that holds them together. And if enough energy is applied to that bond, it could break the bond. And then you have two individual oxygens that are negatively charged floating around. And those oxygens, if it's in a pure oxygen environment, will latch on to the only other thing they can latch onto, which is an O2. Well, they could latch back onto each other, but usually they latch onto another O2 of oxygen. That creates a ring of 3 oxygen molecules.
And that's what ozone therapy is. That's a unique application of 3 oxygen molecules, right?
Correct, in a very specific concentration. So I can't stress that enough. So then we have that concentration of O3 in oxygen, and we can inject it into various structures in the body. In my case, I injected into discs in the spine. I also injected into joints. I injected into muscles. There's a lot of structures that the ozone and oxygen, that's why we call it oxygen ozone injection therapy, can be injected into. And it has amazing healing properties, the combination of the two.
Well, how is it different from somebody going to get a steroid injection into their spine when they've had a herniated disc? Or how is it different from the classical conventional therapies? Why would someone want to get this instead of the other therapies?
All right, so we'll start with the steroid. So steroid has a whole host of side effects. I mean, if you go into the PDR, or we probably don't even have PDRs anymore, everything's online. But if you look at a list of the side effects of steroids, you'd probably faint. They have a whole host of side effects. They're very powerful. Well, there are many different types of steroid, but the steroid that we would typically inject into the spine or into spinal nerves are very powerful anti-inflammatories. That's all they do. They have a little bit of membrane stabilization effect, but for the most part, we're looking for the anti-inflammatory effect. That's all they do, and it's not long-lasting.
I remember a study that came out a few years ago in Texas where they tracked women who had had one steroid injection into their disc in the spine, and it was enough to reduce their bone mass over the next 10 years. Even though everyone says it only has a localized effect, they discovered that it actually had a systemic effect, reducing bone density just by one injection in women over the next decade.
Right. So that's one of the bad side effects of steroids. So with steroids, you're getting a potential long-term benefit, a definite short-term benefit, but it comes with a lot of baggage, which is all the bad stuff that steroids can do. And you don't want to repeat steroids. You could repeat it up to 3 times, for example, in a spinal injection, but each time you repeat the steroids, you're potentially getting an addition of the bad effects. So we'll put that steroid aside for now. And by the way, ozone doesn't have any of those effects, and ozone, which we'll get to, but I don't want to get sidetracked on this. Ozone has a lot of beneficial effects and no bad side effects. In fact, if you repeat it, the beneficial effects are additive with ozone, which is a really great thing. So now you asked about spine surgery. Spine surgery is a totally different ballgame. And I want to just take a step back for a moment. And although I'm against spine surgery for a variety of reasons.
Can you say what you mean by spine surgery?
Well, taking a piece of the disc out. There are all types of spine surgeries. There's microsurgery where where you use a microscope and you just take a small piece of disc out. There's endoscopic spine surgery where you could stick a scope in and pull a piece of disc out from the tube. There's laser spine surgery where you put a laser in and you blast the disc with laser energy and create a pocket inside the disc so the herniation will slip back in. And then there's the open spine surgery. And then there are very invasive spinal fusions. There are disc replacements. So there's a whole host of different types of spine surgery. But no matter what they say, if it's minimally invasive, it's always invasive because you're either pulling a piece of the disc out or you're blasting the disc with laser. And I'm going to get to it. I want to make another important point at some point in this interview because the disc is a very unique a structure in the body, and it has a delicate balance to it, which the surgery disrupts. Now, I also want to say that I have great respect for spine surgeons. I'm not maligning them in any way. The spine surgeon's approach to the procedure is to help the patient. They really want to help the patient, just like I really want to help the patient with ozone, and doctors that do steroid injections really want to help the patient. But what we do to help the patient is completely different. And there are times when you really need spine surgery, like, for example, if your bowel and bladder function, if you have a disc in your neck and it's pressing on the spinal cord and you're losing bowel and bladder function, or you have severe motor weakness and you can't move your leg or something. But right now we're talking about people who have pain from herniated disc. And specifically, this is also important, is people who have pain from herniated disc who have tried other methods that have not provided either the exact amount of relief that they want, the degree of relief, or the length of relief that they want. So, for example, we're not going to jump into ozone disc injection. We're not going to jump into surgery right away, but let's take a typical patient that might have a disc herniation. They have sciatica, they have some numbness, some weakness, and they want to get better. So they start with, let's say, chiropractic treatment, and they get a little better, or they get temporary improvement. Then they go to physical therapy, and the same thing. They might get acupuncture, they might get epidural steroid injections, but they're still having discomfort and it's still interfering with their day-to-day functioning. And they want more improvement. They want to be able to go back to their activities of daily living, the sports that they love, whether it's baseball or skiing or soccer, whatever it is, golf. They want to be able to do these things without pain. And we all feel the same way about medications, that they're a big no-no because they don't work long-term and they have a lot of side effects. So they don't want to take medications. So these are people that are coming for relief, and they've failed what we call conservative treatment. So
I've got just one question for you before you go
Sure.
further. So I'm a dancer, and one of my dance buddies happens to be a physician that runs a pain clinic here in Austin. He's from India, and he told me in India, most of the pain docs and orthopedic docs allow people to just proceed on with their pain because most discs heal within about 6 weeks. If you leave them alone, you have serious pain for about 6 weeks and then they heal. And he felt that in America, we jump in. So you're not talking about those kind of patients. And I wanted to know your opinion on that. You're talking about chronic pain patients who have tried and failed at other interventions. Is that accurate?
Correct. That is accurate. So with acute back pain, most people will get better in 6 weeks. You don't want to jump into doing procedures right away. Okay, if you don't have change in bowel bladder function or severe weakness or some of the other really bad stuff, let's say you pull your back out, or whatever term you want to use, and you have pain, most people will heal. The majority will get better. You go to the chiropractor, you do some physical therapy, you take some anti-inflammatories maybe, or a muscle relaxant or a heating pad, whatever treatment you want. Most people get better, but that's not always because they have a disc problem that gets better. See, this is where you have to be careful, because not all back pain or even sciatic type pain is disc pain. For example, it could be a muscle problem. It could be a facet joint problem. It could be.
Oh, you got to explain what a facet is. I know what it is, but I don't think everybody's sitting out there. They're going, "What's a facet?"
Okay, I'll explain that in a minute. But it's also could be a piriformis muscle, which the piriformis muscle runs from the greater trochanter of the hip to the sacrum, and the sciatic nerve runs right through it. So you could
doesn't it run right through it in about 2/3 of the people? And just by the way, it's a deep butt muscle that a guy named Piriformis discovered. So it's named Piriformis, kind of just so people know. But
right, in everybody it doesn't run, but there's another muscle called the gluteus medius muscle, which could also pinch the sciatic nerve. But I'm just throwing it. That's kind of for a little getting away from our discussion, but I'm throwing it out there because that could create a sciatic nerve type pain, but it's not from a disc herniation. It's from the piriformis muscle pinching the nerve,
squeezing down on it. Right.
Right. So my point, or sacroiliac joint pain could radiate down the leg. Hip pain could radiate down the leg, usually not below the knee, but it can radiate down the leg. So if you lump in all people with back pain, yes, people are going to get better for the most part in 6 weeks, maybe even sooner. If you're looking at disc herniations, and I'm talking about acute disc herniations, it's the majority usually don't get better in 6 weeks, because a disc herniation could take up to 2 years to absorb slowly. And disc herniations do get smaller over time. So, and I don't want to forget, because I'm not writing these things down, I don't want to forget your question about facet joints. So the facet joints are joints on every spinal level, except the very top level, the atlas. It has a different type of joint, but every spinal level has a facet joint, and there's the vertebral bodies, which are the bones above and below. If you think of like a skeleton or a Halloween costume with a skeleton, it has those round bones, right? And then there's the disc below, in between the bones. So that's in the front of the spine. Then as you go back towards the back, there's the spinal canal, which either contains the spinal cord or nerves going through if you get below the spinal cord. And then in back of that are what we call the posterior elements. And two of those, is one on each side, are the facet joints. And the facet joints are joints, and they move when you move your spine.
They kind of look like two faces facing each other, and they're called facets. So it's a little bit, I think of it like that.
Right. And they're small. So if you put two of your fingertips together, that's probably pretty much the size of a facet joint. So without facet joints, if for some reason we didn't have someone someone waved the magic wand and all your facet joints disappeared, your spine would be a rigid rod. You wouldn't be able to move because you don't have joints there. So you can move, you could turn your neck, you could turn your back, because you have the disc in the front and you have the facet joints in the back. Those facet joints, just like any joint, could be painful. You could injure them, you could tweak them, and they cause pain, and they cause back pain, and they also cause radiating pain. So to just lump everybody with back pain, acute back pain, chronic back pain, into the category of disc pain is really not correct. So that was my point.
So how quickly, what exactly is your treatment, and how quickly does a patient experience a relief of their pain? and versus your treatment versus a steroid injection or decompression therapy where somebody's on a machine that kind of mechanically opens up that space. What's the difference between the two, and what can a patient expect?
Okay. Well, first of all, the ozone disc injection therapy is an outpatient procedure. It takes about an hour, sometimes less, to do a disc, depending on where the disc is. It's done under very sterile conditions because so the disc injection therapy is extremely safe. If you look at some of the studies, there's almost no reported side effects or complications. However, anytime you're sticking a needle into the disc, there's theoretically always a risk of infection, although ozone kills bacteria, so the risk of infection is almost zero, but I always keep that in mind. So I do a full surgical prep when I do the procedure, and I develop certain techniques that I use for obtaining the ozone and making sure it's sterile. For example, I use a bacterial and viral filter between the ozone generator and the syringe to make sure that everything is completely sterile. There are various techniques I use.
Did you invent this ozone disc injection technique? Is this your baby, or where did you get this from?
It's been done for many, many years in Europe. It's the Europeans have invented it and perfected it. I actually studied with some of them when I was first learning it. That's how I learned about it. I just have certain techniques that I use, that I developed. I didn't patent or write them out, that make it, I believe, a little safer. Although if you did a control study, it's probably maybe doesn't turn out to be any lower risk of infection because the risk is so low anyway. But it makes me feel good to know that I have extra safety steps in there. So what I do is we give the patient maybe a little sedation. Some patients don't want sedation at all, which is fine. Some patients want a little bit of a Valium type compound, which is called midazolam, which just takes the edge off, makes them relax a little. And using fluoroscopy, I guide a very small needle into the disc, into the exact part of the disc that I feel is appropriate to shrink the disc. And then I draw up the ozone when I'm satisfied the needle's in the right spot, and I inject. So in the beginning of our discussion, we were talking about the proper concentration and the proper dose. So I determine the proper concentration and I determine the proper amount, but that's by feel. So as I'm injecting in the disc, because I've done hundreds and hundreds of these, I could tell by the way how tight the disc is, how firm, or how porous it is, if it's very degenerative, if there are tears in the annulus, which is the outer layer of the disc, I could tell. So I determine how much is injected. And then I would, after I inject it and I keep a little pressure there to make sure it's absorbed into the right spots of this, I pull the needle out. The patient has a recovery period with us in the surgery center and then goes home.
Are they pain-free right then and there?
Well, it depends. So I've had a lot of experience with this. I've been doing it for at least 8 years in the United States, and so I've treated a lot of patients. Some are pain-free right away. Most patients have a little bit of discomfort after the procedure, which is completely tolerable. They don't need any pain medications. And then there's a small subset of patients who are actually in more pain after the procedure, because remember, we're pressurizing the disc with ozone. So if we're pressurizing the disc, it could be a little uncomfortable if the disc is right up against the nerve root. So that could cause a little pain, which we treat with a little narcotic if necessary. So that's a small subset. And very interesting, though, I found that Now, I'm just going to take a step back for a second. And I've also found there's a spectrum of how long it takes for the patient to get better after the injection. So some patients will almost immediately feel better. Some patients will take a week or two, and some patients might be 4 to 6 weeks. Usually it's 2 weeks and the patients see significant improvement. But what I found is that whether or not they have pain after the procedure and how long it takes them to get better has no correlation with how much improvement they get and how long lasting the improvement is. So in other words, someone can have pain after the procedure and it could take them 6 weeks to get better, but they could still have great improvement. I've had patients that I did 8 years ago that are still doing fabulous.
Can you summarize the list of benefits? Like, does the ozone, it kills bacteria, it shrinks the disc a little bit. Does it alkalize the local area? Does it act as an anti-inflammatory agent? Can you just summarize the known benefits?
Yes. But before I get into just the list, I would like to just talk about the shrinking of the disc, which is very important and ties into the posterior elements, the facet joints that we were discussing. So shrinking the disc is just enough, as I said, to take the pressure off of the nerve root. Okay, you don't want to shrink the disc too much. So when you do surgery, whether it's pulling a small piece of disc out with microsurgery or endoscopic surgery or blasting with laser, the disc height will be smaller. When the disc height is smaller, remember we talked about the discus in the front, the facet joints and the neural foramina, where the nerve goes out, it's like
that's
a
the
tunnel.
hole where it's a tunnel,
yeah,
right?
Is in the back. So if the front gets smaller, the back gets smaller, which is not good because it puts pressure on the facet joints and it makes the foramina, which is the tunnel that the nerve comes out of, smaller.
So that's why a lot of people end up down the road getting more pain after back surgery, even if they get initial improvement, right?
Yes, or spinal fusions, or to increase the height. The ozone just decrease the height a tiny drop, almost infinitesimally. You can't even see it on the MRI, but it has a huge effect on the pressure on the nerve. So there's something I learned in college in physics called Laplace's law, and I just stored it in the back of my head. It sounded, like something I'd never think of, but it's basically the difference in pressure per difference in volume in a small sphere is much greater than in a large sphere. So when I learned about that, I thought, oh, that's really interesting, because when I was a kid, when I blew up a little balloon, it's so hard to blow up in the beginning. You really have to push. Then the bigger it gets, the easier it is to blow up. And I always used to think that's because the rubber's stretched, but it's not. It's because of Laplace's law, because the balloon is a small sphere when you first start blowing it up, and then when it gets bigger, it's a large sphere. So you could put much more volume in with a small change in pressure. Now, you might be thinking, well, what does that have to do with disc herniations? So the disc herniation is a small sphere, a small outcropping from
like a little piece of bubble gum coming out of your disc, right, like a big wad of bubble gum sticking on your nerve.
Right. So by decreasing the volume just a tiny amount in the sphere, in the large sphere, the small sphere pressure, which is on the nerve, which is causing the pain,
which hurts like you cannot believe.
Yes, will decrease. The pressure decreases a huge amount, even though the volume doesn't decrease a huge amount.
Now I see why you were explaining that.
Right. So that's why you could get extreme relief without decreasing the volume very much. So now that I've talked about that, I'm going to go through the list. So it decreases the pressure from the nerve by small decrease in volume without decreasing it enough to hurt the posterior elements.
Right. So it's a Goldilocks just right shrinking.
Exactly.
More compared to the more conventional interventions. Right. Okay.
So it's a very powerful anti-inflammatory. It increases blood flow, which is, I'd like to talk about the disc in general at some point.
Okay.
But because this is a very, very important point. So it decreases blood flow.
Because there's not a lot of blood flow to a typical disc,
correct,
right?
Correct.
Yeah, that's part of the problem. Yeah.
That's why I want to discuss that. It increases lymphatic drainage. It supercharges the body's ability to cope with oxidative stress. So that's another huge right. benefit that I would like to just briefly mention. It's a huge benefit. And it also helps the disc heal because of that. And it helps the disc, it protects the disc from future injuries because of that. It also has been shown, this has been scientifically proven, to stimulate the proliferation of fibroblast cells. So proliferation is a fancy medical term for increasing the number. So we know that the number of fibroblast cells will increase with ozone. Now, why is that important in the disc? Well, the disc is it has very few cells, and it's mostly glycoproteins and other things that hold water, and that's how it's very firm and can support our spine. The annulus, the outer ring of the disc, is fibrous. Now, this is theoretical, but it makes sense to me. It's not theoretical that anytime you have a disc herniation, by definition, the disc is breaking through the annulus. So now there's a tear in the annulus.
Right, so the center is breaking through the outside.
Right. So sometimes you could see the tear on the MRI, sometimes you can't. But if it's a herniation, it means that the disc has come out from the annulus, so there has to be a tear. So isn't it great to have a treatment that could actually stimulate the very cells that make up the annulus? Now,
the outer ring. So
right,
wait,
now,
I just have to ask before you go on. I want you to go on.
Sure.
You're just giving us a list of why, if we have a herniated disc, we should consider oxygen ozone disc injection therapy. So how come there are only 2 docs in the United States doing this? How come it's not FDA approved? Of course, I know this is true for so many other things, but can you at least say people are sitting out there right now thinking, if this is so great, if this even helps heal this, and it doesn't reduce my disc so much where I'm prone to post-surgical adverse events down the road, if all this is true, how come there's only you and one other surgeon doing this? I know that they're sitting out here thinking this, and I think it's important to address before we go on.
Well, I think that the key factor is the words United States, because there are thousands of doctors doing this throughout the world, particularly in Europe and also South America. I was at one ozone conference in Germany, and there were people from Dubai and India and all over the world. So we have to ask ourselves, why is it not being done in the United States? There are many reasons. Look, you can't put it in a pill. You can't. There's no medical device to patent. So there's no money to a drug company or a medical device company that would make it worthwhile to spend the whatever tens of millions of dollars it would cost to get it FDA approved. So it's not worthwhile.
I just had Dr. Mary Ruwert on the show. She's launching in a few days her book, Death by Regulation. And she was saying that the FDA trajectory has gone on a path where it basically supports very, very expensive interventions. And if you don't have those kind of interventions, even if you have a good one, an effective one, a better one, it doesn't support that. So here is one more case, everybody, where you really need to be active, proactive to see if we can make this change, because you're hearing about a more helpful way to treat a painful, serious condition. Yet here in the United States today, we're hearing that only 2 docs do it, when when Dr. Warren Bleiweiss is letting us know that thousands of other doctors are doing this around the world. So the FDA, which was set up to protect us, is in many ways harming us. And that's why we have this show. And if you want to keep in touch with a lot of work that I do, you can go to drlindseyberkson.com. You can sign up on my website so you can get my blog and find out about other shows that are coming up. You can go onto iTunes and give me a review to help iTunes promote this so that other people can be hearing this life-saving and important information.
Thank you. So, did you want me to talk about the other issues, or
I do.
That it helped?
I do. What are the other issues that your procedures can help? And then of course people are going to want to know how they can get a hold of you. And I at one point in the talk today, I'm going to want you to talk about some of the home ozone rectal insulfation units that some people are having and what you think of that, because you talk so much about the specific concentration of ozone. So we have a bunch of more delicious things to address. Okay. So please don't go away yet.
Okay.
I hope you have a cup of coffee over there.
Yeah, I actually do.
Okay.
So I wanted to talk. So let's get to the list of things. So I said blood flow, increased lymphatic drainage. We already talked about that. It kills bacteria and spirochetes and virus. And there are
Would it be helpful if people have neurologic Lyme?
Oh yes, definitely. But it would be, but it has to be combined with other treatments. This isn't a primary treatment for neurologic Lyme, and it's not going to get the Lyme in the brain or the spinal cord. That's basically a very in-depth discussion for maybe another time.
We might have to have you back to give an interview on that, because Lyme is such a hot topic. One of my best friends, Dr. Christine Green, we used to practice together, and she's now an infectious disease specialist specializing in that. So we'll get you back on the show to talk about that down the road. But does ozone therapy alkalize the tissues?
No, it's okay. That's not an issue. But what I was going to say is there are theories that the part of what causes disc degeneration over time, one of the causes could be a smoldering subclinical infection in the disc,
right?
From bacterial seeding in the disc, from dental procedures. I'm not maligning dental procedures in any way, but I'm just saying
bacteria can travel anywhere from any place in the body, right?
Right. So, so it has that beneficial effect. It also increases the immune system. But I just want to. So the two really important points, though, are the increase in blood flow and the supercharging the enzymes that help us deal with oxidative stress. So I just want to talk about the blood flow first. So the intravertebral disc
that means between two vertebrae. Yes, intravertebral means it's sitting between two bones.
Yeah, so we could call it the spinal disc.
Okay.
Is a fabulous structure. I mean, it takes so much pressure, and it's like a tire on your car, a bicycle tire. It has a huge amount of pressure inside, and it protects our spine, and it's a shock absorber. It's a fabulous structure. So it's not a delicate structure, but it exists in a delicate environment. Okay, so I want to make that distinction.
Oh, that's pretty fascinating. What do you mean by that?
Well, I mean that since there's no blood flow in the disc, so this doesn't have blood flow. There are conditions as it degenerates, blood vessels can come in from the outside around the annulus, but the inside of this has no blood flow. And the way it gets its nutrients, oxygen, glucose, other nutrients, and it gets rid of the byproducts of metabolism, which are poisonous if they sit around and the cells sit around in them, is by diffusion mostly. So there are blood
That's why
vessels.
exercise is so helpful, because it promotes that a bit, right? So the
Yes,
more you move, the more you feed a little bit your discs. The
right.
more you sit, sitting is the new smoking, the more you starve your discs.
Correct. So the blood vessels in the vertebral bodies, which are the bones above and the bones below the disc. So those are the vertebral bodies. They have blood vessels, and they loop down. They make a loop down towards the end plate, which is the part of the vertebral body that touches the disc. And those blood vessels will nourish the disc, but through diffusion. But over time, the blood vessels could get damaged. And once the blood vessels get damaged, it's a downhill spiral with the disc. That's why almost everybody on the planet gets degenerative disc disease as we age. Partially micro trauma and other things, but also the blood vessels get damaged. The blood vessels get damaged, the disc doesn't get nourished, the cells start to die, the disc doesn't hold on to extracellular water. It's really extracellular fluid, but I'll call it extracellular
It kind of
water.
dries up and is prone to cracking and injury. Right.
Right. And let's face it, I mean, I've been practicing 30 years. I've seen tens and tens of thousands of patients. When you have a healthy spine, you're healthy. I mean, for the most part. I mean, God forbid you have another really bad disease, you're not healthy. But we're talking about people who are healthy in general. When your spine is healthy, you're healthy. And when your spine is unhealthy, it interferes with your whole life. I find people, they can't exercise, they can't do the things they want to do, they can't play with it, lift their grandchildren up, they can't walk far. So, it gets people down in the dumps.
Well, I got to ask you something though. So it's sometimes people get an MRI and their spine looks like a mess, yet they exercise so much or take care of themselves so much that they do not have debilitation and decreased quality of life. And sometimes people have all of these pains and you look at their MRI and it looks perfect. So sometimes you can do a lot of things by the way that you live to accommodate and overcome that. Just isn't that true? So
Yes.
The MRI, your spine it's not always what you see is what you get.
Right, exactly. We're getting a little bit off the track, but if you take 1,000 young healthy people with no back pain, and you do MRIs of lumbar spine on them, 20% or so will have disc herniations. And they don't even know they have them. And yes, there are people with back pain who have normal spines. And yes, a large part of that is how you live your lifestyle. If you have good core strength, if you're exercising and stretching, you're hydrating well, you're eating well, you don't have a lot of pro-inflammatory foods that you're eating, like that contain a lot of arachidonic acid or other things. So all of that adds up. But part of it is also what we talked about before, that there are other structures in the spine that could cause pain. So some people with like normal looking spines could have severe facet pain or severe muscle pain or severe sacroiliac joint problems or other issues that are causing the pain. And some doctor does an MRI and sees that maybe they have a little bulge here, and it's like, oh, that's what's causing your pain. Well, it's not what's not what's causing their pain. But anyway, so yes, you have to maintain your health. But the thing is that you could have a disease. So let's look at the other aspect of your question or your statement. So you could have a spine that is degenerative and disease, and let's say you're 75, 80 years old, and you're doing great because you've done your whole life, yoga for 30 years, and you live a healthy lifestyle, and et cetera, et cetera, et cetera. But when is something that is, and I know this just from experience with taking care of a lot of people, going to tip the person over the edge? to the point where it's painful and then it's harder to get back. It's kind of like driving an old car with old brakes and everything is going fine, but you're at a greater risk if your spine is not healthy. So basically what I'm trying to say is that if your spine is healthy, then you have a much better shot at being active, at leading a happy, healthy, active life as we age. And so one of the things that I had said before is that the ozone helps keep your spine healthy. And one of the ways that it does it is by increasing the blood flow in these vessels in the vertebral bodies, which doesn't start that cascade effect of disc degeneration. So the other thing that's very important is supercharging the body's ability to cope with oxidative stress. This is a huge benefit for ozone, whether you're injecting in the disc,
right,
a muscle, a joint.
I specialize in nutrition for breast cancer patients, and a lot of them are choosing to do ozone, and that's one of the things that is very helpful to create that phenomena in their body to protect against a recurrence. So yes.
Yeah. So that's a very important. So I believe I spoke about this in the beginning, that I also use this to treat joint problems and muscle problems, and it's very effective. But one of the effects that's fabulous is the increasing the ability to cope with oxidative stress. So let's just say that oxidative stress, there are a lot of oxidative stress, but let's just say we'll use the term free radicals.
Supercharged molecules that can cause damage.
Right, exactly. So our body has the ability to deactivate these free radicals. If you like enzymes, for example, like catalase or superoxide dismutase. So if you took these enzymes out of our body, let's say just all of a sudden they're not functioning, we would probably be dead in 2 days from all the oxidative stress that our bodies get. And then we take supplements, a lot of us do, that are free radical scavengers like vitamin C, for example, or omega-3, and they scavenge free radicals. But I just want to make the point, the difference between the enzyme and the scavenger is that the scavenger, there's a fancy term, it's called a stoichiometric reaction. It basically means that it's a one-on-one reaction. It might be a two-on-one reaction, but once the reaction is done, the vitamin C. So let's talk about vitamin C. Once the vitamin C scavenges the free radical, it's done, right? So it's a one-on-one thing. Now, an enzyme is like a factory that the free radicals go in and they come out as innocuous molecules that get excreted from the body.
They get made from being harmful, they're morphed into being safe. But the enzymes can handle more of them.
Yes, so they could handle like 1 million free radicals a second.
Well, how does this happen? Because ozone's a pro-oxidative therapy. So now you're talking about it being antioxidant. This is a super point for you to clarify.
Okay, so that's a great question, and it's a fabulous point. So remember in the beginning, I said a very specific concentration of ozone. So that's really important. So we're talking about micrograms per milliliter of ozone. Okay, now if you just blasted someone with 100% ozone, it's very harmful, right? But we're putting a tiny drop of ozone in the body. Now, what does the body do when it's confronted with a stress? Like, for example, if you take a 10-pound dumbbell and you do curls with that dumbbell, well, that's a stress to your bicep muscle. So what does the body do? It creates a bigger bicep muscle, right? And then in a few weeks, you might be able to curl with a 20-pound dumbbell because your body reacted to the stress. Or if you sit around, if you're a couch potato for 20 years, your bones are going to get weak. If you do high impact aerobics or other things, your bones are going to get strong. The body, whatever stress you put onto the body, the body fights back. So when the body sees these small quantities of ozone, it says, hey, we're getting this small signal, if you want to call it, to get our acts together and get these enzymes ramped up and create more of these enzymes to prepare for possible more of this stuff.
So let me just summarize this. You're saying that it's a pro-oxidative. It pushes the body to release more antioxidant capacity.
Correct. Yeah.
So that is what it does. So that's why people say, well, how can ozone be safe? We're supposed to run into the house if it's too much in the air because it's pro-oxidative. Well, a small amount, the Goldilocks right amount in the body creates the body. It gives muscle. It's like going to the antioxidant gym. You buffed in your antioxidant buffed muscle capacity.
Yes, I like that analogy. Yes, it's very good.
Thank you. I'll pat myself on the back over here. I just want to ask you something. So I'm going to bring this to personal. So I've been working out all my life and eating well all my life, and a lot of my listeners know my history, so I'm not going to go through that. And I have not been somebody who has had aches or pains at all. That's not been, most people do. I'm older. I don't have that. So about 4 or 5 years ago, I was giving a lecture, and all of a sudden I felt this ominous pain in my derriere, and I could not bend my knee, and I had tremendous pain in my knee. It was so bad I couldn't bear it. And I went to be seen by an expert who, by the way, was 100 pounds overweight and told me people over 40 shouldn't work out, and that's why she had to practice. Well, that's another story. And she said I just had a sprain, and I didn't. So I went and got my own MRI because I wasn't going to get it from her. And it turned out that I had a 12 millimeter far lateral disc, which means that the disc, when it's pushed out, hits 2 nerve roots, and the pain is off the chart. And that's a rare type of disc. And when I saw a neurosurgeon the next day, he wanted to put me into surgery immediately. He said, everybody with this should be done. Well, I wasn't going to do that. So I stayed at home and I got an anti-gravity chair. I got all these books on ways I could avoid getting scar tissue to grow and this and that. And within about 7-8 weeks, I was back to the gym for 2 minutes, the next day, 3 minutes. And now I have absolutely no symptoms left at all. I can canoe, I can dance marathon on the weekends. But when I get a post MRI, I still have that same 12 millimeter, which they said was large for my age, because normally at my age, my disc should be more dried up, but I guess they were pretty buffed. Why is it that I have no symptoms now at all? I'm back, if not better, but when you look at my MRI, it looks like it's still the same pressure on the nerve.
Right. So that's a great point. And it's related to what I was talking about before. And I talked about it in 2 separate ways. So what you're seeing on the MRI is the volume of the disc. So you're seeing how large the disc is, but it's not measuring the pressure on the nerve.
Oh,
so our herniated disc by itself is not painful. All right. Remember I said before that you could take 1,000 people with no back pain and do MRIs. So you're going to find a lot of herniated discs. What's painful is when the herniation presses on the nerve in the canal, in the foramina. And the tunnel. Yes, the tunnel. And the foramina is the bone on all sides. It moves a little because it's part of the facet joint, contributes to the foramina, but it's bone on all sides. It can't expand. So if you do back surgery on someone with an acute disc herniation and you look at the nerve is blown up like a balloon. It's all swollen and angry looking. So it just gets trapped in the canal, and the disc is pressing and pressing and pressing on the nerve. There's nowhere for it to go, and it's a vicious cycle. Now, if you could, by whatever means, and we don't do ozone right away, typically.
How soon do you do it?
It depends. So it depends on how painful the person. Like, for example, that severe pain you had.
Oh my God. I thought that I could not live with this pain. I'd never have experienced pain like that in my life. And it was
Right.
only in my knee. It wasn't in my back, and it crescendoed every night. It would crescendo at 8:00 at night and go throughout the evening where there was no way I could sleep. And then it would come down a few font points at 8:00 in the morning. It was such a specific cycle.
Yes. So sometimes some patients just can't take it, and if it doesn't go away in 6 weeks, they want surgery. And they might try a little bit of physical therapy, some pain meds, but they can't get out of bed. Excuse me, they can't get out of bed, and they just can't take it anymore. So they want surgery. But typically, we want to wait a few months to see how the patient does. But if you take the scenario where someone can't stand it and they want surgery, they're a great patient to try the ozone on, because we might be able to avoid the surgery.
Now, I've got a question. Well, where I am now with no pain, but obviously I have disc degeneration, am I still a candidate to come to see you to have better nutrition to my disc and have all of those other lists of benefits that you said?
I would not, if you don't have pain, I would not inject your disc with ozone. If you're functioning well, if you don't have pain, I would not inject your disc with ozone. There are other things that we could do to a disc if it's severely degenerative, which is a topic for another discussion.
Ooh, I'm going to have you back. I already want to know.
Yeah, such as you might want to look it up, alpha-2 macroglobulin. I actually have a separate website for that. But so there are other things you could do to keep the disc healthy. See, what you don't want,
and that's what everyone that's out there listening that's had a disc issue or has seen degeneration on an imaging and you don't yet have issues, we're going to have him back for another show to find out what we could do to do great nutrition and preventative support for our discs. That's a big deal.
It's a big deal, because if you wind up, you or anybody, any of us, winds up with spinal stenosis later on in life, that is a major problem, because spinal stenosis, I don't want to get too much into spinal stenosis because it's another topic, but it's basically a narrowing of the spinal canal. So it's like a donut with the hole is smaller, and it pinches all the nerves going down. And the typical symptom is that you can't walk far and you have to sit down, because the longer you stand up, the more severe the pain is. It's very debilitating, and it's a problem because it usually requires, once it gets really bad, it usually requires surgery. And some of the surgeries are big decompression surgeries, and sometimes it requires hardware. So the ability to prevent the spinal stenosis from happening in the first place is a huge, huge plus.
So that's what your other therapies that you have and your other website. So we're going to have you on again. I'm excited to hear that myself, because you just heard that I'm probably a candidate for that. So, but I want to thank you so much. Is there any concluding? Welcome. I know we're getting close to the hour. This has been so exciting to hear about treatments that we don't usually know about and why it has such a long list of benefits compared to the typical treatments. This has been so enlightening. And I want to remind all my listeners, if you feel like getting a gift from me and getting my brand new, very great article on oxytocin and all of its, how it came to be, what exactly it is, how we understood it, and its applications in clinical practice, you can text 345-345. Just put in your phone to text 345-345. And when it comes up, what password, put in Sexy Brain, which is the title of my newest book, which is all about how brain tissue is under attack by hormone altering chemicals and why it's so important to understand how to keep your receptor functionality optimal. And so if you text 345-345 and put in Sexy Brain, you can get that gift from me. So can you summarize what we've been talking about? This has been such an exciting and unusual conversation, and I really appreciate you giving me your Saturday morning, Dr. Bleiweiss.
Oh, thank you. So I'd like to end by comparing the ozone with the surgery. So the surgery, as we said, alters the anatomy. Once you have surgery, you can't put everything back together if it didn't work. Or let's say the patient gets 50% better and they want to get another 50% better. Well, you're not going to do another surgery, because if you look at the statistics on how people do after a second surgery, it's not very encouraging. So it alters the anatomy and you can't change it. And it disturbs the disc. And the disc is a very fragile environment because of what we talked about with the diffusion. The ozone, on the other hand, it has the same effectiveness. Both are about 80% effective with herniated discs. It doesn't alter the anatomy. It's actually healthy for the disc. It doesn't do anything harmful to the disc, and it could be repeated. So most of my patients get better and they only need one treatment and they're doing great for years. Sometimes patients will get 50% better whether they have surgery or whether they have ozone, and they're happy, but they want to be able to do a little more. They want some additional improvement. You could repeat the ozone. In fact, the benefits are additive. And some patients are better for 5, 6, 7 years, and then they do something and the pain comes back, or the pain comes back. Again, with the ozone, you could just repeat it with no adverse effects. With surgery, it's a problem. You already have altered anatomy. There might be scar tissue. There's other issues going on, and it's not something you just jump in and repeat. So, plus there's no downtime with ozone. You could have the procedure and go to work the next day. It's not like surgery where there's usually significant downtime, and it's very, very safe and it's very effective. So I feel that it's the best treatment for disc herniations, unless, as we discussed earlier, you have a really severe issue like change in bowel or bladder function or very, very profound weakness.
So if somebody wants to get a hold of you, you are in New Jersey. Can you say exactly where you are and how, if somebody is out there, they already have a surgery set up and they're pondering if this might be a better alternative, or they're pondering a surgery, or they have a dear loved one that has chronic severe pain from a disc injury, how would people get a hold of you?
Well, my office is set up for out-of-town patients. We get a lot of people from all over North America, and we even get patients coming from India and the South Pacific. So we're very set up for out-of-town patients. My office is in Caldwell, New Jersey. It's
Caldwell?
Caldwell, yes. It's about 14 miles west as the crow flies from New York City. And we could either, on my website, there's a way to email us, which is a secure encrypted email a patient could send their information.
Can you give your website? Is it www.alternativedisctherapy.com? And
Correct.
I'll say that one more time if you want to take a look at what Dr. Bleiweiss does in his website. It's www.alternativedisctherapy.com. And remember, the United States FDA has not yet approved this. So when you go there, it is a direct pay procedure. Is that accurate?
Yes, it is.
Okay, so that means cash. That's because the FDA hasn't approved it yet. And I find that most of the medicine interventions I use these days are all that way, because the ways that a lot of allopathic medicine offers aren't the ones that I choose to do. Sometimes they are, but much of the time they aren't. And often those are cash pay, and they're worth it, because many times if you do the regular intervention, you pay more down the road with suffering and even with economics. So is there any other way, website that you want to tell them about, or any other way that?
Well, yes, there's also, you could call 973-403-3334. My office is open 5 days a week from 9 to 5 Eastern Standard Time. And usually 9:30 to 5. And then the regenerative medicine website is www.spineandjointtreatment.com.
Is that the one, spine and joint treatment?
Treatment.
Okay, so that's www.spineandjointtreatment.com. So is that the one that you talk about, this alpha 2 macroglobulin?
Yes.
Alpha 2, I've never heard of that before. Alpha 2 macroglobulin. So I'm going to scoot on over there when we get off the phone and take a look and see what you got. And I'm going to, of course, invite you back on. But thank you so much, Dr. Bleiweiss. It's, knowledge is power. And for us to know that we have more possible choices, and then we can make our decision which way we want to go. But this is very, very enlightening. I myself have been using, as people know, ozone for treatment of something else. That's a whole nother story. But I hold ozone therapies near and dear to my heart and my eyesight. So I want to thank you so much for coming on the show and giving us these alternatives.
Oh, you're welcome. By the way, disc could be spelled two ways, with a C or a K. In the medical literature, in the web, we spell it with a C, not a K. But if you look in the medical literature, you'll see it spelled both ways. It's like EKG. You could use ECG or EKG. I believe it has to do with the German versus English. But anyway.
Okay. That's nice to know. Every other sentence from you, I'm learning something new. Thank you so much. And I look forward to having you on the show again.
Okay.
Everybody, thanks for listening. And remember, when you need to have an intervention, you need to take a look at all of your possible choices, the pros and the cons, the long-term possibilities, and make an enlightened decision. That's why we have these shows, so you can get in on dialogues with people who are doing cutting-edge, pioneering procedures. Thank you so much, everybody. Bye.